You're listening to Puma Podcast.
We only want the best for our family, kaya gusto natin healthy ang kanilang kinakain.
Pero alam ba natin kung ano ang totoong laman ng ating pagkain?
Kapag nasobrahan tayo dyan, maaari itong mauwi sa iba't ibang
Did you ever wonder just how nutritious the food we eat really is? We often see labels in grocery stores claiming certain products are healthy choices. But gaano ba ito katotoo? In this episode, we dive into the push from health advocates for clear warning labels on food packaging. How can these labels help make us better, more informed decisions about what we put on our plates? To better understand why it's important to have warning labels on food packaging, we need to consider non-communicable diseases or NCDs. Ito yung mga sakit na hindi nakakahawa tulad ng cancer, diabetes, at heart disease. And over the years, NCDs have been rising as among the leading causes of death here in the Philippines.
At the top 10 causes of death in the Philippines, 70% of them are non-communicable diseases. Top 1 would be ischemic heart disease. Second would be cancer. And we also know that obesity is in the rise in the country. And nutrition, obesity are risk factors or pampataas ng posibilidad na isang tao ay magkaroon ng non-communicable disease. Meaning, it is something that we can help prevent.
That was Dr. Maricar Sabiñano. She's the oncology manager for the Philippine Cancer Society. She was speaking at a media roundtable on food warning labels by Imagine Law, Health Justice Philippines, and the Healthy Philippines Alliance, a growing network of health advocates and legal experts. She explains that one of the risk factors for NCDs is an unhealthy diet.
I'd just like to alert everyone. Dahil sa kinakain po natin ito, and even children below 18 are having hypertension, which we did not see 30 years ago. I'd just like to highlight na among all of these, they are getting younger and younger. So, unlike before when I would see diabetes nga or hypertension or cancer in old people or senior, now they're getting younger and younger. So what does it mean? Something is happening in our food environment. Talagang napakalaking bagay po talaga that we advocate food warning labels just to make our people aware that what we're eating is what we're causing our.
And that was Dr. Jaime Galvestan, former health secretary and lead convener of the Healthy Philippines Alliance. While we often hear that habits like smoking and poor diet increases our risk of NCDs, does that mean we just need to switch to healthier eating? Absolutely. But experts say it's not as simple as it sounds. Okay, so imagine this. It's a Monday evening after work. Pagod ka na, pero kailangan mo pang bumili ng groceries for the week. Anong bibilhin mo? Ako, admittedly, I tend to pick out things like soy milk and canned goods na madaling lutuin. Pero syempre, I try to go for the low-sodium variants. Maybe some cheese and some spreads kung gusto kong gumawa ng sandwich. And yes, 25 years old na ako, bumibili pa rin ako ng chicken nuggets. Pero I like to choose the chicken breast variant dahil sabi kasi sa packaging na it's a good source of protein. And I won't deny it, bumibili rin ako ng instant noodles kapag ubos na talaga ang energy ko magluto after a long workday. So if you noticed, I'm usually drawn to products na may label na healthier options like low sodium or good source of protein. And I kind of base my choices on the claims in the packaging din. Pero sabi ng health experts natin, some of the food we think is healthy may actually be high in salt, sugars, and fats. So these things, they aren't necessarily bad for us, pero may recommended daily amount tayong dapat sundin. Kung sobra-sobrang intake natin ng sugar or salt, it can eventually lead to the risk factors for NCDs like obesity. Pero paano naman yung mga tao na may NCDs na? They're already aware na kailangan nila ng low sugar or low salt diets. Pero hindi pa rin ganun kadali ang pagpili ng mga bibilhin. That's where clear food labels can make a big difference.
Low salt, it's hard to conceptualize for a normal general Filipina, but if you have it in the front of the pack, nasa gitna kung canner bottle, nasa top right, kung packaging, madali na para sa kanila yung choices. And that avoids complications, and that avoids yung top causes of death natin.
Doc Maricar and fellow advocates envision these food warning labels placed at the right, ideally sa top right ng packaging, para makita agad ng consumer. These labels are black octagons with warnings that the food product may be high in sodium, sugar, total fats, saturated fats, or even all of the above. With these labels, hindi na natin kailangan mag-compute kung mataas ba ang salt or sugar content ng mga bilihin natin. Pero teka, paano kayang implementation nito? At kung may food warning labels na, di kaya malulugi ang mga food manufacturing companies? More on that after a quick break. Public health experts like the Healthy Philippines Alliance and Health Justice Philippines are pushing for food warning labels to be placed at the front of packaging, hoping to help us make better decisions as consumers. But will it actually work? Attorney Mikhail Milan of Imagine Law says that this measure is already being implemented in other countries.
Warning labels are currently being implemented in Chile, Peru, Mexico, Uruguay, Argentina, Israel, Brazil, and by 2025 also in Canada. So ano ba yung effect ng warning labels when it's implemented in a particular country? Studies have shown how easy it is for consumers to understand warning labels without the fact na may IEC campaign.
He says that the implementation of warning labels triggered important effects. First, consumers in these countries began choosing different products, perhaps much healthier options.
So there was a study first done in Peru where they found out that 58% of the study participants actually change their buying behavior whenever they see warning labels.
And second, it pushed companies to reformulate their products to make them healthier.
There was also a study done as well in Peru wherein yung nagkaroon ng warning labels yung products. The prevalence of products with warning labels sa beverages and food dropped down by 28% and 20%. Ano ba yung sabihin nun? Yung nagkaroon po ng warning labels yung mga produkto, 28% of the products were reformulated. Meaning, binago po yung composition ng pagkain para po mawalan po ng warning labels. Meaning, naging healthier po yung pagkain. As public health experts now, we're doing just our duty to further public health in the Philippines. At the same time, as the industry, we are expecting them to also just do their duty in furthering industry interests. But that doesn't mean naman that we can find a ground wherein we can properly implement food warning labels here in the Philippines. So as already mentioned, these multinational companies are already complying in several countries already with regard to food warning label regulations. And apart from that, this will actually, based on studies, it will actually incur to little to almost zero production cost po sa mga manufacturers because every 6 months, they actually relabel their products for promotional purposes. They always repurpose their label. They always change their labels for sales, for promotions, etc. So putting warning labels there will not be something done na out of their way, but something that can already be inserted in their standard operating procedures.
Food warning labels are just one of the proposed solutions in the fight against non-communicable diseases in the Philippines. They aren't the silver bullet to minimizing those risk factors. While other countries have proven that they help, legal experts emphasize that they need to be complemented by other policies. Bills on food warning labels, such as the Healthy Marketing Environment Act, are already in progress in both the House and the Senate, and they're awaiting hearings at the committee level. These bills also include provisions aimed at encouraging healthier eating habits, including taxing junk food, providing healthier food options for public school students, and proposals to regulate commercials for unhealthy food and drinks that are targeted towards kids. The Department of Health envisions Filipinos to be among the healthiest people in Southeast Asia by 2022 and in Asia by 2040. And if we want to achieve that goal, we can start by giving Filipino consumers the tools that they need to make better, healthier choices. And that was today's episode of Teka Teka. Gusto ko lang din magkwento tungkol sa nangyari during that event with Health Justice Philippines, the Healthy Philippines Alliance, and Imagine Law. So we were given a variety of products, milk, cheese spreads, powdered juice, crackers, and based on the current packaging, the nutrition facts, we had to determine if the product was high in sodium, sugar, saturated fats, or total fats. Not gonna lie, nahirapan kami. So I can only imagine how difficult it must be for an ordinary consumer na nagmamadaling mag-grocery, walang oras mag-calculate ng mga nasa nutrition facts, and make better decisions about what they're buying and eating. Again, I'm Tatiana Maligro. This episode was edited by Pidoy Blanco, and our Teka Teka executive producer is Jill Caro. We hope that this episode encourages you to carefully consider the food that you eat and recognize the importance of food warning labels. It would also mean a lot if you shared this episode with someone who wants to also make informed decisions about their food choices. Thanks for listening.